This week in the Missouri Senate, we review two more measures that could be part of a future legislative session.
Senate Bill 629, the insurance...
Senator Scott Sifton of Afton sponsored Senate Bill 629 during this year's regular legislative session. On March 4th, he told the Missouri Senate Seniors, Families, and Children Committee his proposal would have made changes to the Ticket to Work health assurance program.
These are folks who work, are disabled. They need attendant care services to literally to get out of bed in the morning and get to work. Once they do, they're able, in most cases, to earn considerably more than the Medicaid eligibility cutoff. But because there is no other provider for the services they need besides Medicaid, the state nonetheless tends to regard them as the same as the rest of the Medicaid population, even though their income is generally different than that. They simply can't afford private insurance to provide the care that they need, and so the state does it.
During committee discussion, Chair Senator David Sater of Cassville mentioned he has sponsored similar legislation in past years.
Well, I was on a interim task force. In fact, we were in St. Louis one time and had testimony for this particular program. So we formulated this bill from that. And so I've always been a proponent for that bill. It makes sense.
Other legislation from this year includes...
And Senate Bill 584, the low...
Senator Lauren Arthur of Kansas City sponsored Senate Bill 584. On January 29th, she told the Missouri Senate Seniors, Families, and Children Committee her plan sought to modify provisions relating to child care benefits.
However, if that same parent earned $1,889 less at the time of the application, they would have been eligible to pay $2,400 per year instead of the average $5,000 to $10,000 per year for care. And that equates to about 10% of their income rather than 27%. So the out-of-pocket care cost difference is $4,700 a year.
During committee discussion, Senator Cindy O'Loughlin of Shelbina said she wishes more entities could be included in the proposal.
I just want to make the point that it seems like everything we do is either in the cities or Springfield or, while I'm not saying that they don't have a need, I would bet as a percent of the total population, ours would be higher. The fallacy of a lot of the things that we do to help people might be helpful at first, but they basically lock you into it forever. And then on the other end, we're always griping about, why don't people move on up and out of this? Well, they can't.
The next regular legislative session will start in January. And remember, you can follow these and other issues facing the Missouri Senate by visiting our website, senate.mo.gov. Reporting from the state capitol, I'm Dean Morgan.